Understanding malaria. What is malaria? Malaria is a disease caused by a parasite called Plasmodium, which is transmitted to humans through the bites of infected female Anopheles mosquitoes. It is a serious condition, but it is preventable and curable. Who is at risk? Malaria can affect anyone, but it is most common in tropical and subtropical regions. People who live in or travel to areas where malaria is widespread are at a higher risk. Causes of malaria. How is malaria spread? Malaria is spread by the bite of an infected Anopheles mosquito. The mosquito carries the malaria parasite, and when it bites a person, the parasite enters their bloodstream. Is malaria contagious? Malaria is not spread from person to person like a cold or flu. It cannot be contracted through casual contact with an infected person. What are the common symptoms? Fever and chills, headache, muscle aches and fatigue, nausea, vomiting, and diarrhea, sweating. When to seek medical help? If you experience any of these symptoms, especially after visiting an area where malaria is common, see a healthcare provider immediately. Early treatment can prevent serious complications. Diagnosis of malaria. Blood smear microscopy. A small blood sample is taken and examined under a microscope. This is the gold standard for confirming malaria and determining the species of parasite. However, a negative blood smear doesn't rule out malaria, so the test may need to be repeated sometimes every 12 to 24 hours for a total of up to 3 sets. Rapid diagnostic tests, RDTs. RDTs are dipstick-like tests that can produce results in less than 15 to 30 minutes. Polymerase chain reaction, PCR, tests. Quantitative Buffy, Coat, QBC, technique. Treatment for malaria. What are the treatment options? Medications. Malaria is treated with specific anti-malarial medications that kill the parasites in your body. The type of medication and the length of treatment will depend on the type of malaria and how severe it is. Rest and hydration. To help your body to recover. Medications. Malaria is treated with specific anti-malarial medications that kill the parasites in your body. The type of medication and the length of treatment will depend on the type of malaria and how severe it is. Anti-malarial drugs include artemisinin drugs, artemether and artesunate, chloroquine. There are parasites that are resistant to this medication. Doxycycline, mefloquine, quinine, primaquine. Complications of malaria. Malaria can lead to several serious complications, especially if not diagnosed and treated promptly. Here are some potential complications. 1. Cerebral malaria. Cerebral malaria is a severe form of malaria that affects the brain. 2. Severe anemia. 3. Organ failure. Malaria can cause multiple organ failure, including kidney, liver, or spleen failure. 4. Blackwater fever. A rare complication characterized by the rapid destruction of red blood cells, leading to dark-colored urine. How can you prevent malaria? Use insect repellent. Apply insect repellent on exposed skin, especially during evening and nighttime when mosquitoes are most active. Sleep under mosquito nets. Use insecticide-treated mosquito nets to protect yourself while sleeping. Take preventive medications. If traveling to a high-risk area, take anti-malarial medications as prescribed by your doctor. Prevention of malaria. Is there a vaccine? Currently, there is a malaria vaccine called RTS-S AS01, but its availability is limited to certain regions. Glossary. Parasite. A small organism that lives in or on a host organism and gets its food from or at the expense of its host. Antimalarial medications. Drugs used to prevent or treat malaria. Insecticide-treated nets. Mosquito nets treated with chemicals that kill or repel mosquitoes.